Vishanjali, you can start.
Okay, sir. So good morning to everyone. Good morning. Hello, sir. I'm audible, no, sir?
Yes, yes.
So good morning to one and all present here. I welcome you all for the PhD webinar series organized by Microbiology Society. Today's speaker for PhD webinar series, Dr. Priyanka Sarkar, ma'am. I welcome you, ma'am. So ma'am is currently working as a postdoctoral research fellow at Institute of Translational Research, Asian Healthcare Foundation, Asian Institute of Gastroenterology, Hyderabad, Telangana. Also, ma'am has received 2 patents on her name. Also, she has published various research articles in reputed journals and 4 book chapters and also 2 popular articles. Also, I would like to mention that she is receiver of Young Scientist Award from Microbiology Society India in December 2022. So I welcome you, ma'am, once again, and now I request you to start your presentation.
Please allow me this screen sharing option.
Now you are co-host. Priyanka ma'am, you are co-host now. You can share your PPT.
Yes, sir. Is it visible now?
Yes, yes. Make it on
Yes.
slide mode.
So, good morning, everyone. I would like to thank Microbiology Society of India for giving me the opportunity to showcase my research work. So, next 10 to 15 minutes, I will quickly take you through the research highlights which I have done in my PhD. So, my topic is effect of alcoholism on human gut microbiota in comparison with that of colorectal cancer patients. Since it's a gut microbiome, we all know that we are more microbial than human. We have 100 trillions of microorganisms. Like basically, we are a live petri dish. So my sponsor agency was DST, Department of Science and Technology. Primary research focus on microbiome in health and diseases with the special interest of develop a novel therapeutic strategy to manipulate the gut microbiome so that we can modify the natural history of chronic diseases. So now what microbiome? So whenever we speak about microbiome, we generally speak only bacteria. We have other microflora as well in our gut. So we have like bacterium, which is dominated by Firmicutes and Bacteroidetes, then microbiome dominated by Candida and Saccharomyces, archaeome, virus, protozoum, and helminthes, etc. So now why we came up with this alcohol thing? Origin of alcohol consumption traced ancestor. That is, we have the from our ape ancestor, we have the habit of eating fermented off the ground, and we have the paved the way to ability of digest the alcohol, ethanol. So now what ethanol is doing in our body. So this is a report which was in 2019 by WHO that 92% of Indian population are spirit drinkers, that is, they are distilled beverage drinkers, and only 7% are fermented alcoholic beverages drinkers. And if you see the alcohol attributed death, so if you see the death of alcohol attributed, which is again the report of 2019, we have 3.3 billion deaths a year. If you take alcohol, it generally in microbial scenario, it creates dysbiosis. It alters gut microbial population, which leading to elevated level of endotoxin production, then intestinal permeability increase, and disease of short chain fatty acids. So when we started the work, that time we had 2 points in our mind, that gut microbiome is responsible for colorectal cancer development, as well as alcohol is again responsible for colorectal cancer development. It's one of the etiology. for CRC. So now we thought that is there any missing link? To know more on it, we have the objective of this study based on to study the effect of alcoholic beverages on gut microbiome and metabolome. Cohort-based study, which primarily we dealt with the humans. Then we have different alcoholic beverages on gut microbiome. This is a validation phase, which we experimented in mice, and to find out the commonalities, that is, common link or common bacterial dysbiosis or metabolite link in alcoholic as well as colorectal cancer patients. So this is the flow chart of the parameters used for the study. So we have enrolled 27 alcoholics and 15 non-drinkers. This is a pilot-based study since we enrolled the volunteers which have a long history, like 10 to 12 years history of alcohol drinking. Then we collected their fecal samples. Then we went for the culture-based study, and since we all know that gut microbiome are 90% of our gut macroflora are unculturable, we opted for metagenomic-based study. So we isolated metagenomic DNA. Then we went for TGG-based gel analysis. Then to know more about the macroflora, we went for V3, V4-based NGS analysis. So upon receiving the results, we again validate our finding by using a mice model, alcoholic mice model. Here we have, I will explain it later on. So we have again collected fecal blood samples to know more about the microbiome as well as metabolome of this blood, of the alcoholic beverages, of the impact of alcoholic beverages. So let's come to the results. So what we found our human-based study is, this is a picture of a DGG gel image, where each band corresponding to a different bacterial species. So majorly we found Prevotella copri, which is the common, which carries the signature of common Indian gut microbiome, common Indian healthy gut microbiome. It reduced in alcoholic cohorts. Ruminococci, again, which is a beneficial macroflora, has been found in reduction in alcoholic cohorts, where Bacillus and Clostridium are found more in alcoholic cohorts. So upon observing the results, so what we tried is, so when we observed the results, we found that there is a difference between non-drinkers and drinkers, which was expected, but the drinkers of different alcoholic beverages, so if they're drinking fermented alcoholic beverages or distilled alcoholic beverages, their gut microbiome is also different. So to know more on that, we performed the experiment in mice model, where we have taken 2 months old Swiss albino mice, and then we have categorized or grouped them into type 1, type 2A, type 2B, and ethanol cohort. So we have treated different alcoholic beverages to these mice. We have also taken a ethanol cohort to know that what exactly only ethanol can have the impact on gut microbiome as well. So we have done stool collections as well as blood sample collection for metabolite profiling. So for stool, we again, metagenomic study, we have analyzed with the base of DGG, and then we went for NGS based analysis, and blood metabolites we have done through GCMS. So now how our results look like. So this is a PCOA plot, principal coordinate plot, based on the gut microbiome or beta diversity of the macroflora of the mice. So here, if you see each color represents a different treatment. So if you see the plots, you will find that they are clustering together based on the color, or based on, should I say, based on the treatment. So this is the scenario we have observed after 30 days and 60 days of alcohol treatment. So majorly, so should I admit him, sir? Hello.
Hello. Yes, ma'am.
It's okay. So now, if you talk about the bacteria which has been found altered in throughout the experiment, we have again Prevotella copri, which has been found altered in alcoholic cohorts. Bacteria like Helicobacter and Core phenomenotici, which is not a good gut bacteria, is found elevated or more in alcoholic cohorts. So we also done metabolome profile. Since bacteria alone, like by profiling the bacteria, we cannot know the whole story. And metabolites is the end product of any metabolic activities happening in our body. So we done the metabolome profiling, and majorly we see that we have seen that butanoic acids or butyrate, which is very good for our intestinal epithelial cell regenerations, are found decreased in alcoholic cohorts after 30 days and 60 days of treatment, whereas acetic acid and valeric acids are found more in in alcoholic cohorts. Then we went through plasma metabolome profiling again. So we mainly targeted the amino acids profile. So we found that threonine and serine are found to be elevated in the alcoholic cohorts, whereas methionine has been found more in untreated group. So if you see the results, not only like you will see some differences between the different alcoholic beverages. We have consider for the treatment. So to know what is the difference between alcoholic beverages, we profile their chemical compositions, and we found that a sugar molecule, which is arabitol, is uniquely present in one alcoholic beverage, and ethanol, which is a synonym of acetaldehyde, is again present in all three of these alcoholic beverages. So then we administered or treated ethanol and arabitol in mice, and we found the similar scenario of depleting good gut bacteria in the mice, which has been treated with both ethanol and arabitol as compared to the untreated mice. So this proves that not only ethanol, but the non-ethanolic components of alcoholic beverages is also creating havoc to our body. So now our final goal is to find out the commonalities of both alcoholics and colorectal cancer patients. Here we have taken 45 colorectal cancer patients. When we studied microbiome, we have to take care of the antibiotic intakes, because antibiotic itself causes biases. And if you see any other parameter with if you study any other parameter on gut microbiome, it is very important. Your volunteers or participants should not take antibiotic for at least 3 to 6 months. But since it's a cancer cohort, they have a high risk of sepsis or any infections. So they are frequently giving therapeutic antibiotics, prophylactic antibiotics. So for that, we have only we could only enroll 45 patients, which has not been taken antibiotic for 3 months. And when we profile their microbiome profile, we found that both alcohol and alcoholics and colorectal cancer patients have a common bacterial dysbiosis. And what are these? We found that more bacteroids, Helicobacter porophoromonas, Klebsiella, are more in both this group. On the other hand, Bifidobacterium, Prevotella, and Rubinococcus, which is generally considered to be a good gut bacteria, mainly corresponding to a butyrate producer, and producers, are found reduced in both the groups. If we talk about the metabolites, we found that IL-1 beta, TNF-alpha, linoleic acids, and isoleucines, etc., more in these two groups, whereas butyric acids and propanoic acids are less. So this proves our point that alcohol creates dysbiosis, and it may lead to the severe pathogenicity of cancer development, or it may pave the pathway of cancer development. Although we need more research on that, and we try to mimic our results in mice model with azomethoxam, 15 mg per gram body weight, but we could not, 50% of our mice, we did not observe any colorectal cancer tumor development in our mice. So that is the reason we haven't shown any mice model results as per to the CRC work in this presentation. We also tried the effect of we also tried to go for effect of unique compounds, whether it is creating any effect in culture-based microbiome or not. So this study we have currently completed and we are communicating. So we found that culturable microflora is also changing, and we are hoping for a good results in it. We have also tried to know how we can restore the dysbiotic gut bacteria by giving fecal transplantation, rice beer treated, and probiotic treatment group. Due to conflict of interest, I'm not showing these results. Hopefully, in my next presentation, if I get the chance, I can show the results in detail. Here, I want to highlight my recent work where we are working with the type 3C diabetes. Well, we all know about type 1 and type 2 diabetes, right? Type 3C, comes with the like pancreas has two function. One is exocrine and endocrine. So mostly type 3C diabetes comes when we have a loss, we observe a loss of exocrine tissue in the or exocrine system loss in the pancreas. So this work we have recently published, checking whether their microbiome profiles are also different or not. This work we published recently in 2021, and we are now currently treating the patients with FMT to check whether their insulin sensitivity or insulin resistance can be, can be improved or not. So finally, I want to acknowledge my two PhD mentors and my postdoc mentors for giving me the opportunity, and also MBSI to give me the opportunity to showcase my work. And please feel free to reach me at my email ID if you have any query. Thank you.
Thank you, ma'am, for your presentation. Now we would move towards a question answer session. Participants, if you have any doubt, you may ask directly or you may put your question in chat box.
Good morning, madam. It's a wonderful work with useful data to just give a insightful warning to the people who are suffering with alcoholic habits. So my area of interest, we are also working on gut bacteria and diabetes. Could you just please throw some light on the good bacteria which support the uh, diabetes, or in a way which cure all the microbes, helps in recovering the insulin resistance?
I'm sorry, I could not get your question. Voice is breaking
Yes,
up.
ma'am.
So good
Is it
bacteria.
audible now? Yeah.
Yeah,
Which
good
are all
bacteria.
the normal bacteria which are available in non-diabetic individual, which are deficient in the diabetic individual. And let me know which way we can improve the insulin sensitivity. This is my interest. Is it
Okay,
clear, ma'am?
so you want to know the bacteria which can improve the insulin sensitivity, right?
Sure.
Okay. So as per our study, so we have conducted a recent study in 300 patients. Okay. So we found that mostly butyrate producer like Ruminococcus bromi, Faecalibacterium prosnitzi, these are the bacteria which these are the prominent bacteria which can shown to improve the insulin sensitivity in terms of incretin responses. So till date, we have only found that these two bacteria are being depleted apart from other genus of other species of Ruminococcus. These two are the major genera of which has been found depleted in type 3C diabetes, and which is also found depleted in type 2 as well. Am I clear?
Thank you. Yeah, it's clear. Thank you, ma'am. And also, from your presentation, I come to know that the butyrate is the key, right? So, apart from this acetic acid and propionate, butyrate is, doing good to the system.
Correct. Butyrate has a dual role. Our intestinal epithelial cells generally uses butyrate for cell regeneration. It has also role in maintaining the cell checkpoint, in like maintaining a proper apoptotic pathway. So that's the reason, like when we talk about short chain fatty acids, we have plenty, we have 5 or 6, which is mainly scientists are having research on. One is butyrate. The main is butyric acids or butyrate, then propanoic acids or propanoid, acetate, valerate, and you will find some more in that. But butyrate is one of the important, and I would say most important SCFA, which has been studied, and it has it exerts a potential beneficial role to our intestinal epithelial cells.
Thank you, ma'am. I do have some information to share with you. I'll share through the mail. Like we are working on the targets which can stimulate the insulin sensitivity. We work on short chain fatty acid produced by the probiotic. So I'll share with you. It will be useful. Possible, I will also get some work to be collaborate. Thank you, ma'am.
Sure.
Thank you, sir.
Sure.
Thank you.
So you have, please feel free to contact me. I have my mail ID. So it's priyanka.aig@yahoo.com. We'll be happy to answer your queries.
Thank you. Thank you so much. Thank you.
Any question from participants? You may put your question in chat box also. I think so, ma'am. There is no question. Participants, do you have any doubt? You may ask directly.
I hope I have not bored you all.
No, no, ma'am.
Okay, in that case, if none of you has a question, I have a question. So who believes that God is everywhere? Can we have vote or yes, or can you raise your hands? So my question is, do you believe God is everywhere? If yes, then say yes or raise your hand. If no, then don't.
There is reply from 2 people.
Only two.
Yeah.
Only
Yes.
2% believe.
Yeah.
No one believes God is everywhere except this 2%.
There is another reply. One more reply.
Only 3. Okay.
Raising their hands.
Okay. So I'm not sure God is everywhere, but you will find microbes in almost everywhere. So keep study microbiology. It's a very interesting topic, and we need to know more about this prokaryotic world, which is within and outside of us. So if you study gut microbiome, since I already told that it has been a very prominent field. So microbes, if you Google it, gut microbiome paper, you will have plenty of papers. and you will be astonished to know how these microbes are working day and night for us. So thank you. And again, if you have any queries, you can reach to us and we'll be happy to solve your, we'll be happy to answer your questions or your query. Thank you so much for the day. And also, I'm very much thankful to MBSI Society, Microbiology Society of India, to give me an opportunity to contact, to showcase my work and communicate with you all. Thank you.
Ma'am, there is one question. Ma'am, please suggest the project topics for MSc Microbiology. So I think ma'am has shared email ID. So you can contact her on email ID also. Or if you want to answer ma'am now, you can answer it.
So it's better if she or he can mail me. So there are a lot of things which you can do, but based on your timing as well as the facility available in your lab or in your institution. So please email me or please be in contact so that we can discuss further on it.
Okay. Thank you, ma'am. I think there are no more questions, and I would like to thank you because you gave your time and your presentation was very good. You gave us insight of your topic. Thank you, ma'am. Also, ma'am has given us a very good message that you should study microbes because they are present everywhere and they are how they are helpful to us. So this message was good, and yes, microbiologist people will they are always working in that area. They are working day by day new microbes, and also they are doing research. So thank you for giving this message, and also all other participants who are present for this webinar. I thankful to them and all other people who are present at the backstage that they are uh, uh, indirectly they are helpful for making this webinar successful. So I thankful to them also. So thank you everyone, and we'll meet next Sunday. Thank you. So you
Thank
can
you.
let ma'am.